Growing up, my dream was to play professional basketball, and I hold this ball to remind me of my failed dreams. When you grow this size, you got to get new dreams. This is Paul, Dr. Nacho, founder of Dental Nachos and Dentist Job Connect. I am so excited to be talking to my guest, Dr. Hans Stasiuk, who is involved with a fantastic organization related to sports. Hans, I'd like you to just orient our audience as to kind of who you are. Tell us a little bit about the organization and what you do for it.
Well, Paul, thank you for having us on today and supporting the Academy for Sports Dentistry. And the Academy was founded in 1983 in San Antonio, Texas, by a group of like-minded people, dentists, athletic trainers, coaches, who decided it was time to do something and start spreading the word on how we can prevent and treat dental injuries in sport.
Yes.
And the ASD has, grown from 83 now, and now we're almost 40 years old. And I'm a dentist in rural Manitoba, an hour away from Winnipeg.
Awesome.
I teach part-time at the dental school on the clinic floor with pediatric dentistry, and I do a lecture on sports dentistry and mouthguard fabrication every year to the dental students.
I give you a lot of credit that, I did a multiple year GPR at a hospital where I got to see some kind of crazy trauma things. And I'll never forget, I think it was like my 28th birthday. The trainer from my high school called me up and said, someone was hit with a field hockey stick. Can I send her to your office? And I said, sure, I'll take a look at it. I felt confident in managing the first step because I had so much training in trauma as a GPR resident. And these things are not just physically traumatic, but as you know, I see the picture behind you, emotionally traumatic for our patients. So for dentists, Hans, that want to get involved in this organization, what benefits do they get out of it?
Well, probably the most important benefit I say is networking. You get to meet some great people from around the world. Most of our members are in United States and Canada, but we do have dentists from a lot of other countries. And it's phenomenal what you learn from each other. And I've always said that you sometimes learn more in the evening over a drink in the lounge than you do during the day sometimes, not to take away from the important lectures during the day. It's unfortunate when we're in the lounge in the evening that we can't get some CE points, Paul. I'm so sad. I say you learn just as much from having an event over the coffee, the wine, the bagels, or all three at the same time. It's a CE event. Calories don't count. That's how I live my life when I'm at a CE event. So yeah, and I'll give a quick example of the networking. Friend of mine's a dentist in Brazil, and he sent me a message on WhatsApp a few years ago and said, I've got a athlete who's an MMA fighter and he's in Fresno, California, and he forgot his custom mouth guards back home. Can you help him out? Well, he had no idea how far away I lived from Fresno, California, and I'm also in a different country. So as luck would have it, I have two colleagues that are involved with the ASD and they live there. So I contacted one, Dr. Jared Mosley. He and Jared hooked up on WhatsApp. The next day, Jared scanned his teeth.
Cool.
Then on the Thursday, Jared gave him 3 custom mouth guards, didn't charge him anything.
That's really awesome. I love those stories. It's truly Dental Nachos, always be connecting, making people feel better. Really awesome story there.
So that's one of the biggest advantages, and just learning from each other. So it's not just the networking, but it's learning how to prevent dental trauma and how to treat dental trauma. And it's not just through sports. So the ASD is not just for team dentists. It's not just about, even though we talk about sports a lot, you could be involved in a car accident. Your patient could get hurt on the school playground. And it's the same type of injuries that you're treating, and the treatment's gonna be very, very similar.
Yeah.
But by having it sounds nice too, that it's called Academy for Sports Dentistry, and it's also a way for people that do want to get involved with teams. It's a good starting point.
Yeah, that's great. We have the Philadelphia Eagles team dentist in our area here, and I just think it's a cool opportunity for you to do this. Tell us a little bit. I'm excited to be one of the speakers at the symposium. I love getting dentists together face to face. Where is the symposium? When is it? And what will people learn there?
So I'm really excited. I'm always excited about every symposium, but this year in particular, because I've always wanted to go to Nashville, and it's going to be in Nashville, Tennessee, June 22nd to 24th at the Hilton, which is, from what I understand, it's right in the heart of all the country life bars and restaurants. And it's a three-day symposium. First day, we have a team/sports dentist course. At the same time as that's going on, if people don't want to take that course, we have a second track going on with some other lectures related to sports dentistry. And then on the Friday and Saturday, we have a series of lectures all related to different sports dentistry topics. And I tell people, even if you have nothing to do with a team and have no interest in helping a team, you've got patients that are playing sports.
Sure.
Even someone like yourself, Paul, who's probably a weekend warrior, right? And accidents can happen anytime. And they almost happen more often with these weekend warriors than they do in organized sport.
I'm practicing for the senior NBA. It's not a thing. It hasn't been invented, but my hope is it might someday. So you brought a prop to share with us. I mean, mouth guards are, I know this entire thing is more than just mouth guards, but I'd like us to kind of just share with our audience what you brought here.
So this was a custom mouth guard that we made. You can see how hard it is for me to try and get this mouth guard off. There, finally got it off. So custom mouth guards are the way to go. There's a lot of ways to help prevent dental injuries. And one of the main ones is wearing a custom mouth guard. And the Academy recommends custom mouth guards in over 40 different sports.
Yeah. What is a sport maybe that, I'm a parent, like what is a sport that a child's playing right now that you might not think you need a mouth guard, but you really should need a mouth guard for?
Basketball is one sport that a lot of people don't think about. And if you watch basketball on TV, it's pretty rough under the boards.
Yeah.
Younger kids, when my son was grade 7, grade 8, he played basketball. I made sure he wore a mouth guard, otherwise he wasn't allowed to go on the court, and he was the only one wearing one. And so I was hoping that other parents would buy in and start getting mouth guards, and they wouldn't. So
it is what's kind of nacho nuts, Hans, is these parents, they'll spend thousands of dollars on the sport, the travel, the equipment, this. And for some reason, when I have them in my operatory and I'm striving to explain the benefit of custom mouth guards, they say, I'm just going to buy one from a sporting goods store. And I say, well, if your child ever really needs it, the protection is not going to be there, because as you shared, that tight fit of the custom and the different layers is clearly superior to what you can boil and bite into.
Oh, Paul, you get it. Parents and football equipment's usually supplied. Hockey, parents are usually buying the hockey equipment. Our son hasn't played hockey in years, so I have no idea what the cost is now. But I know at one point parents were spending upward of $200 just for a hockey stick. Probably $1,500 to $2,000 for equipment. Then they get to the checkout stand, and they see a display there of mouth guards.
Yeah.
Like, oh yeah, I need a mouth guard. So they'll spend $5 on a mouth guard.
Yeah, it really is. It's a shame. And also, I tell parents when, they give me some pushback, I say one single tooth, put the emotional trauma aside of it. The financial trauma to you can easily be $10,000 for that tooth by the time they have to invest in bone grafting, dental implants, temporary prosthesis. So we're on the same page with that.
Creates a lifetime of problems, doesn't it, if you don't protect your teeth?
Yeah, for sure. Now, let's say I have a lot of people in this audience who, might want to come high-five me in person in Nashville, Tennessee. We want to get our Nacho Dentist out to support. Join this organization. It's only $210 per year. Is this a good event for a first-timer? Could they just say, hey, I want to sign up and just see what it's all about? Will things be over their head, or will they be able to get some value out of it?
So, Paul, I graduated in 1995 and attended my first symposium the next year in Minneapolis. And I didn't know anybody when I got there, but I had done 2 term papers. I was in dental school, and a lot of the people that I had referenced for my term papers were actually at the symposium. They were either speakers or attendees. So I got to rub shoulders with them, and now I'm friends with every single one of them. And it's over 25 years later.
That's awesome. We're on live Nacho TV. It's a channel in my mind, Hans. And someone asked, what is the best mouth guard for braces?
So a lot of people give their patients boil and bite mouth guards because they say the teeth are moving. But the boil and bite mouth guards, also known as mouth-form mouth guards, the one you warm up in water, they still don't fit that well. And you're better off to make them a custom mouth guard, and remake them one every 2 or 3 months.
Yeah.
I do orthodontics myself as part of my practice, and I make all my own mouth guards. And if you're charging someone $7,000 to $8,000 for braces, it's not costing you that much to make a mouth guard, and you're helping your patient, you're helping the parents. It's reassuring to everybody, and it minimizes the chance of you getting a phone call at 10 o'clock on a Saturday night when you're getting ready for bed.
Yeah.
That you got to go to the office because all of a sudden some brackets are off and the face is all inside, the face is all cut up.
I want to ask, tell us a little more about your in-office mouth guard process. Do you have one of those machines that do different layers? Is it a scanner? Is it digitally printed? Combination of all? Tell us about that.
So the best machines to make custom mouth guards are the pressure laminating machines. And there are different companies that have machines, and they'll be at some of them will be at our symposium, so everybody can get a chance to take a look at it. Also, we have a mouth guard fabrication course as part of the team dentist course, and people can try out the machines and get an idea how to use them. So in our office, when I first graduated, I had a vacuum form machine, but they don't make mouth guards that are very good. They don't fit that well because they're just a suck down. The pressure laminated work very well under high heat and high pressure. And as you can see from the skull, it's very hard to take the mouth guard off. So I'm still doing impressions, even though I have a scanner. I'm just sort of in between scanning and impressions at that stage. And I just bought a digital printer. And so the plan is to start scanning everyone's teeth that are getting a mouth guard made, and then doing the models in our office, and then not using a 3D printer to print the mouth guards yet, just using a regular pressure laminating machines.
Yeah, awesome.
So it is a little bit controversial too. I would say some people say that you can't make a great scan and you can't get high enough in the vestibule for adequate extension for the mouth guards. Other people say, yes, you can. So
nice.
I think it's just getting used to it and technique.
Well, come to the event and see them fight it out. That's what dentists are good at, the controversy to scan or use. I love Silginot I know you guys use the sponsor Kettenbach, an algin alternative I use for a lot of these things as well. Well, you've shared so much great value with us, Hans. We're going to get a chance to hang out in Nashville, Tennessee, June 22nd to June 24th. I love the concept of what you guys do because it seems like you're friends, you're having fun, you're learning, you're laughing. It's all things dentists should do more of. Anything else you want to add about the benefits of being part of ASD and the organization?
I just want to add to that. This year we've revamped the team dentist course. We're calling it team/sports dentist course, because a lot of people felt, well, if I'm not a team dentist, why would I take it? Well, yeah. First of all, if you are a team dentist, you should take it. So you have that extra knowledge and the networking capabilities. And if a problem arises, you're not sure what to do, you can easily contact one of your colleagues. Yeah. You can choose not to work with a team, still take the course. You'll learn lots. And how we've revamped it is the didactic portion is now going to be offered online starting in a few weeks. You'll complete the didactic portion before getting to Nashville, and Nashville will be all hands-on. It'll be oral cancer workshop, mouthguard fabrication, splinting, and suturing.
Great. These are things that you can change people's lives in the best way. You can be ready to help your community. It could happen inside and outside of your office with helping people. So I love the whole mission. Hans, can't wait to meet you in person at the event. And thanks so much for sharing with us today.
Well, thanks for giving us the opportunity, and thanks for coming out to our symposium to help us out and lecture.
Can't wait.
Sponsor.
Thanks.